It's been 15 days now since the earthquake hit Nepal on 25th of April. We've all witnessed firsthand damage, destruction, death, pain that people in Nepal have gone through since the earthquake. It's not been easy. It's not been easy, but I think we have made some progress. We have collectively identified the needs with our partners, and we've kind of translated it into an emergency response strategy. I've visited all our key partners now, spoken at length about priority needs of affected population in the districts. I've visited two worst affected districts, Dading and Sindhupalchok. I've witnessed the hostility and inaccessibility in these terrains, but I've also witnessed the resilience of people who live out there. We have been responding to the needs of injured people since day two with our partner HRDC. We have now come together with an emergency response strategy after 10 days of elaborate discussions with the affected communities, with our partners, with international and national response mechanisms that have been set up since earthquake hit Nepal. So basically what we're doing is we are focusing on two key areas of intervention. We are supporting the needs, immediate needs of people with injuries. This includes medical, surgical, psychosocial and physical rehabilitation needs of all the people who have gone through trauma and all the persons with disability who have been affected during this earthquake. We are doing so with our key partners HRDC, INF, TLM Nepal and Koshish. It's important to underline that all this response is in very close cooperation with the coordination mechanisms that are set up in the country, and this includes Ministry of Health and Population, WHO, international and national agencies that are responding in health sector. It's important that we create synergies and we don't duplicate efforts in such a situation. The other key focus area for the emergency strategy is to advocate for the rights of persons with disability to equally access relief aid that's been organized in all the affected districts. We are partnering with National Federation of the Disabled Nepal to address this key area. Our aim and objective in this particular aspect is to work with the cluster mechanisms that are set up and to influence every thematic area of intervention. So let's say if there are health interventions happening, we would like that they become inclusive for persons with disabilities, starting from needs assessment to planning of interventions to monitoring and their participation. At field level, we are mapping out the persons with disability and their families who are affected by the earthquake, identifying their immediate needs, and then creating referral mechanisms with mainstream agencies who are actually working in those areas, be it food aid, be it water and sanitation, be it shelter. So hopefully with these two key focus areas, we will be having an effective response which addresses the needs of persons with disability in the affected districts. At this point, I'd like to take a moment to thank our national team here in Nepal, who have been incredibly cooperative, supportive of this whole intervention. They've gone through some very difficult times themselves and yet stood by us and reached out to population, trying to do their best to support them. Our partners have been excellent. They've had some horrible stories to tell us about how their families and friends have gone about during the earthquake, and yet they have come out and did all the assessments and planned for response and been engaged in the response. So I would like to also thank our member associations who have been incredibly supportive during the whole period and have allowed us to come out with this strategy, and hopefully we'll be implementing it for next 6 to 9 months. So I stay very hopeful and positive, even if I think the road to recovery will be long. But I really wish everybody else who is involved in this as well all the best